Meemansa. How do you
Thank
feel?
you, ma'am. Thank you so much, ma'am. It's a completely different feeling altogether.
And Meemansa, was telling me कि मैम अभी भी ऐसा नहीं लग रहा है कि ये मेरी rank है. So Meemansa, tell us that if initially I ask you to summarize this journey, of starting your PG preparation and reaching to this wonderful rank, tell us something about it.
Ma'am, I had started my journey right from my second year. So at that time, I had realized that competition is tough. So I need to buck up. So that was when I had joined DAMS, and since then I've been reading standard textbooks. I've been solving MCQs. Then towards my internship, things became a bit difficult, as in duties were heavy, and I had a lot of T&Ds to complete. So I think I've been consistent, and that's what brings me to this day.
Yes. So as you said, you joined DAMS in your second year. She's been a 4-year student, and in the internship, she followed it up with TND. So, Meemansa, मुझे बताओ, was starting early an important factor? And when you started early, a lot of times you don't start with clearing PG preparation in your mind as your goal. So,
Right, ma'am.
how did you work then? And I'll gradually move up to your internship as well, and I'll ask you how you prepared with TND. But how about your undergraduation years? When you were studying with us.
Ma'am, I think the biggest motivation for me, because of which I had joined DAMS in my pre-foundation year, was that I still remember Sethi sir had come to UCMS, and he was giving his lecture about basically radiology only. So he showed a scan of HSV encephalitis, and most of my seniors were able to get it right.
Okay.
And I still remember I was absolutely clueless. I had just passed my first year and I had no idea what was going on.
Yeah.
So that was when Sir gave a very important message ki always and always when you are deciding what to read, from where should you read, compare the bulk of books. Like you have guides, उसका bulk भी उतना ही होगा जितना तुम्हारा standard का होगा. So that was one big factor which helped me in deciding कि DAMS would be the right place for me, at least for guidance, because obviously I didn't have a good idea about teaching at that time, but yeah, for guidance definitely.
Yes. So I think that's a very, very vital thing, Meemansa, जो हमें लगता है that you've highlighted, that it's important to realize that when you are beginning, it's not necessary that you think of yourself as a winner or think of, your bigger goals, but the sole idea of, not compromising on your education is so, so important. I think that's where you took the decision that you're going to read good books,
True,
you're going
ma'am.
to make your notes, and you're not going to compromise, है ना? तो फिर अब मुझे बताओ, Meemansa, did you make your own notes and do you think those were useful and were you using them even close to the exam, bache?
Definitely, ma'am. I had completed my first and second year subject notes in my second year itself.
Okay.
Being in pre-foundation classes, I had completed my third year subjects and final year subjects in third year.
Okay.
So by the time I had entered final year, I had all my notes completed. So I think that was the most important thing in my preparation. And during my final year, I mainly focused on final year subjects
Okay.
by reading the standard text. So
Okay. So now this is also something that I want to really ask you, Meemansa. This year the paper was very clinical. It was an integrated paper as well. And you were studying with us, from past 4 years. So, if I may say that, do you realize that it doesn't matter that, you know, uh, uh, whether, you are saying कि इस pattern में पढ़ाया जा रहा है या नहीं, if you are good with your content, if you are doing your basics well and you're learning the application of your basics, the change of pattern doesn't affect much.
ma'am, that's absolutely true. Like what I had experienced is ki during my final year, I had started preparing for USMLE, bits and
Okay.
bits, not much. And that was when I realized ki the course is more or less the same. It doesn't change much.
Yeah.
Be it NEET, be it next, be it USMLE, everything is the same. So DAMS notes were like gold to me in both the journeys.
Right. And also now, Meemansa, let's talk about when did you start practicing MCQs? I mean, when did you start taking PG entrance as a major goal and, started to go all out for it?
Ma'am, speaking of PG entrance, I think third year was the time when I decided कि PG entrance के हिसाब से ही करना है.
Hmm.
But I had started practicing MCQs in second year itself. Like after
Okay.
every DAMS class,
Okay.
I used to practice those MCQs related to that topic
That's great.
from like DQB, and I think there was a Robbins review also from there as well.
Great. So I think one thing that I can make out while talking to you is consistency. Huh? So you have ensured कि जिस year में आप पढ़ रहे हो, whether it is second year or third year, you're very thorough with that year. And as if you're going to do it for the last time. I think
Yes,
that
ma'am.
is a wonderful take home message कि बहुत लंबा journey मत सोचो.
Hmm.
Whatever you're doing in the current time, I think that's what I could gather when I'm talking to her, that whichever year she was in, she was being very thorough with it, as if this is the last time she'll be able to do it this in this much depth. So good content, reading in good depth, and practicing questions side by side, and being consistent right from the beginning of your
Yes, ma'am.
journey has sort of brought you this far, Meemansa, and it's very very inspiring. तो मुझे ये बताओ, Meemansa, what keeps you on track?
Ma'am, I think the biggest contribution is of my parents. They give me the right balance of confidence. When I'm underconfident, they instill me with confidence, and when I'm going wrong, they tell me that okay, अब थोड़ा normal हो जाओ.
That's great. Yes. So, because of so many distractions and things around, one tends to lose focus. So, if I may ask you, when you got, let's say, deviated from your main path, how did you sort of ensure that you're coming back? It could be not so good rank. It may be a poor performance in a TND, but how did you ensure that you keep coming back to your journey?
Ma'am, I think I had a very good support system. I had some awesome friends during my MBBS.
That's
I
wonderful.
had great seniors during my internship. So anytime I felt like ये तो नहीं हो पाएगा, I used to give them a call, and they literally counseled me for 1 to 2 hours on call. So I think that was a big motivation for me.
That's
Apart from
great.
that, I used to search motivation videos on YouTube. Though I recommend कि my juniors shouldn't waste that much time on that, especially during the last days. That's what. So those motivation videos were really helpful.
That's great. Acha, now let's talk about your internship. Can you, tell us a little more in detail, because there'll be a lot of students who are preparing with internship, and somehow a lot of people put it in their mind कि नहीं, internship के साथ नहीं हो सकता है. You
True, ma'am.
cannot get a good rank and you must drop. So I think, Meemansa, can you tell them that of course it is possible, you've done it, with internship, you've got a very good rank, but can you also tell in detail how did you balance out your work and study?
Ma'am, I think the first step would be to have a clear plan in your head.
Okay.
You should know कि कब तक क्या क्या हो जाना चाहिए. For instance, if you have a hectic posting coming up, then you should be clear that okay, I'll be able to spare only 1 to 2 hours per day.
Right.
So maybe I'll take up a not so light, a not so heavy subject
Yes.
during that part of my internship.
Yes.
Apart from that, I think it's very important to complete that subject then and there. For example, if I am doing my ENT internship right now,
Right.
it's important that I should complete ENT then and there only.
Okay.
So that was one thing. Apart from that, it's important कि at least 3-4 months before exams, you should have your TND notes completed. You should have completed your first reading of your main notes and PYQs as well,
Great.
so that you can complete your second and third readings subsequently in the given 3-4 months.
Okay. And Meemansa, can you tell us something about strategy with TND? So there will be a lot of students who are doing internship and then they are doing test and discussion course with us. तो थोड़ा सा अपना strategy बताओ कि दिन को कैसे divide करते थे, कैसे पढ़ाई करते थे? How did you use the tests and how did you use the discussions? And how did you go about the entire process?
Ma'am, I think that giving the test and listening to the discussion on the same day,
Okay.
that is a very important part. Like usually what we do is कि test starts दे दिया and then discussion we are watching in parts. That kind of blurs your recall of your test. So your attention to discussion is likely to get compromised. So I think watching them on the same day is very important.
Okay.
A good idea would be that you can balance your off day of internship with the day of your test and discussion. That is
Right.
a good strategy. Or else what you can do is कि you can club all your TNDs towards a light posting.
Yes, because now all the TNDs are available on
Yes,
the
ma'am.
app itself, and you have the entire video library also uploaded for the TND. So you can, choose if you have a heavy posting, then you can select which ones do you want to go ahead first with.
Yes, ma'am.
Right. And Meemansa, आपने अभी बोला था that you said last 3 months you want to keep for revision. Yes. So उस वक्त क्या strategy थी for last 3 months?
Ma'am, for the last 3 months, I think First of all, taking second and third reading of your main notes, that's important.
Okay.
Then it is also important to ensure ki the T&D notes which you've made, they're not just for namesake. You have to read them at least twice and thrice
Okay.
to ensure a good retention.
Okay.
And ma'am, thirdly, what I did, especially towards the last 7 days of my exam, was that I had marked important topics from PYQs.
Okay.
So instead of focusing on main subjects, I focused on the important topics from PYQs of all subjects.
Right. So that is again a very, very important message. Please don't spend your entire energy on medicine and surgery. They are very vast, and no matter how much you do, you know
Absolutely, ma'am.
there is no end to it. You must give a good weightage to all subjects. Especially, I would like to say, the SARPO or the short
Yes, ma'am.
subjects. They are integrated a lot with clinical subjects, and if you have a good hold on them, they're very scoring as well. What would you say, Meemansa?
Ma'am, I absolutely agree. Like towards the end of my internship, and let's say 20 days from the exam, I had revised SARPO at least 4 or 5 times,
Right.
because that's the part where you can get 5 out of 5 questions right.
Mm.
In medicine, it's not practically possible, or
Mm.
maybe it's a little difficult to get, let's say, 23 out of 25 questions right.
Yes.
So SARPO
Yes.
is very scoring.
And now let's come to the last month before NEET PG. What was your strategy in the last month? How did you revise?
Ma'am, I had planned 2 more cycles of revision
Okay.
for the let's say 14 days after my internship.
Okay.
So during that time, I used to study 12 to 14 hours per day. I revised again the important topics from previous year questions.
So I was going to ask you this because your juniors are going to ask you this, that
Yes, ma'am.
when you say you planned 2 revisions, was it back to back or cover to cover of your notebook, or was it selected revision?
Ma'am, selected, absolutely selected.
Right.
And towards the let's say last 7 days of my preparation, I had I practiced more and more MCQs rather than focusing on theory. I did PYQs 20 to 50 questions per day.
Okay.
Sometimes maybe 100 questions per day. So
Okay.
that helped me develop an aptitude for the exam.
Okay. And also, I would like to ask you about, the grand tests, right? So, what
Yes, ma'am.
was the number of correct questions that you could achieve in the grand test, and how close do you think you would have been in NEET?
Ma'am, my performance in grant test has significantly improved during my
Okay.
internship. So when I started the internship, at that time I used to get 145 questions correct
Okay.
out of 200. It gradually improved to 160 questions out
Okay.
of 200 in the month of September.
Great.
And finally, in the last CBT, I got 167 correct.
That's
So
wonderful.
in this NEET, I had 172 correct. So I think it's pretty close.
Yes. So, yes. And since you mentioned about CBT, did you go and give it at an exam center?
Yes, ma'am, I
So,
did.
how is the experience and how important is that, I think, close to the exam?
Ma'am, I think it's extremely important to remove that stress factor, that
Right.
uncertainty factor. It's very important. And also, the papers are very predictive. Especially speaking of the scores, they're extremely predictive.
अच्छा and मुझे एक और चीज़ जाननी है मीमांसा. You said that your GT performance gradually increased and you reached about 160 to 170 correct questions. So definitely when I hear it out, and if I consider myself like a junior who's listening to you, I
Yes,
would
ma'am.
want to know how did you manage that, ma'am? That is, that's
Yes,
how we
ma'am.
will ask you. So tell us, how did you manage to improve your GT scores? Because a lot of people struggle as their scores stagnate at a certain level.
Right, ma'am. Ma'am, I think the major role was, I think the most important thing was that I had recognized my weak spots. With every GT, I was recognizing that, okay, my ENT is not as good,
Okay.
my obs gyne is not as good, I'm forgetting this topic. So I used to revise those topics over and over. I think that worked for me. Apart from that, TNDs of those subjects in which
Okay.
the subjects I was weak at, that helped me a lot.
Wonderful. And also, Mimansa, tell us about your DVT experience.
Yes, ma'am.
This year it has been a major hit rate in the exam, and
Absolutely, ma'am.
we are getting wonderful reviews, and we're really thankful for it. And how is your experience with it?
Ma'am, I think DVT in itself is gold for your last minute revision. Uh, the mind maps, they were extremely helpful. In fact, I could recall some of the algorithms of obs gynae in the exam, Mullerian
Right.
abnormalities wala.
That's great.
So it's gold.
All right. And now let's come to the exam itself, Mimamsa. जब आप paper दे रहे थे, what was the feeling that you were getting? Can you analyze something about subjects as to which ones were really important, which had a more weightage, which were relatively tough, and the overall pattern of the exam as well?
Ma'am, I think in INI and in NEET, I think one thing which was common was कि ऑब्स गाइनी का वेटेज काफ़ी ज़्यादा था, ऑब्स गाइनी एंड ऑर्थो.
Hmm.
In INICT, I didn't see PSM that much, while in NEET, there were many PSM questions,
Okay.
and all of them were conceptual.
Yeah.
So, I think obs gynae, PSM, and ortho, these are subjects which shouldn't be neglected at any cost.
And they're scoring.
Yes,
At
ma'am.
least I feel
Absolutely.
obs and gynae is scoring, but I might be biased because it is my subject. So, but overall, I would say as compared to medicine and surgery,
It is, ma'am.
OBGY is definitely, sort of more scoring. It's limited things, and a lot of it can be put into algorithms, and you can,
True, ma'am.
standardize it. So great. And now tell me कि exam में अच्छी feeling आ रही थी जब paper दे रहे थे, was time management a concern, or and did you feel that yes, it is a well set paper, because I think the paper was quite integrated
Yes,
as
ma'am.
well.
Ma'am, I think for INICT, I had mixed feelings.
Okay.
But for NEET, the first impression was that paper is very easy.
Okay.
So, that is the moment when you realize that you can't go wrong in
Hmm.
the easy questions. You can't make any silly mistakes. So, the first impression was that easy hai. I had attempted around 198 questions. I had
Okay.
left 2 because the paper were totally clinical.
Okay.
The options were not very straightforward.
Hmm.
It required some application of what you might have seen in your wards,
Yes.
what you might have read in your books. So questions were not direct.
Yes. So it was. They are changing the trend over
Yes,
last
ma'am.
2-3 years, making it more clinical. Yes, there will always be some factual questions. You can't deny that. But I think the number has greatly reduced as far as NEET is concerned. There were still some factual things in INICT.
Yes, ma'am.
So I think it fluctuates from some year to some year where they put a little more factual and then they might put a little less. Okay, so Memansa, all in all, a very, very dedicated girl, and I think someone who has been, very focused into her preparation. And let me ask you, what makes Memansa a high achiever?
Ma'am, that's a tricky question. I think consistency and the thing that I can't give up, that never giving up spirit, that has helped me in reaching where I am right now.
Great. And Mimansa, ये मैं पूछना चाहती हूँ because this is a question which sometimes pops up in everybody's preparation stage, and that is, अगर अच्छा नहीं हुआ तो क्या होगा? So did you ever have those phases where you felt that अगर अच्छा नहीं हुआ, या
Yes, ma'am.
अगर if things don't go my way तो क्या होगा? So how did you, combat that part?
Ma'am, I think at that time parents become the best persons you can talk to. So uh, that was when my parents told ki outcome is something which you cannot control. The only
Yes,
thing which you have in your hands is your hard work.
true.
So
Yes, so the most important thing is that we should all detach from the result,
yes, ma'am.
and don't give yourself any plan Bs. Don't think about what if, and just go with a single track mind that this is how it is going to be. I am going to decide my future and I have the power to do it as well. I think that's all we need to do. We need to detach ourselves from the result and just
True,
keep
ma'am.
putting our best foot forward. Okay, Mimansa, so now let me ask you the question: what branch do you want to pursue?
Ma'am, I really want to pursue a surgical branch, but
Great.
I'm putting some thought into it right now.
Okay. So she's figuring out what she wants to do, but I'm sure whatever she is going to pursue, she's going to do it absolutely great because
Thank you, ma'am.
of your core dedication skills that you have. So I wish you a very, very bright future ahead, Mimansa. And in the end, I would just like to ask you, is there any special message that you want to give out to your peers or juniors or colleagues?
Uh, Ma'am, I would like to say that know what you're doing when you're doing it. Just don't think about कि वहाँ पे क्या चल रहा है, that I have so much to do. Just be there. Just know what you're reading at that moment. That is going to help a lot.
Yes, so staying in the moment. Yes, that's a wonderful advice, Mimansa. And I congratulate you once again for
Thank you so
achieving
much,
an
ma'am.
amazing rank 63 in your first attempt. in NEET PG 2022, and the entire DAMS family is proud of you, and we wish you a very, very bright future ahead.
Thank you,
And
ma'am.
always stay connected to us, Meemansa. God bless you.
Thank you so much, ma'am.